Good morning, student. I'm Yogitha. Welcome you to the learning session. And today we'll study about a sexual disorder. So, the sexual disorder, we can find different disease under the sexual disorder. There are four types of sexual disorder: gender identity disorder, psychological and behavioral disorder related to sexual development, disorder of sexual preference, it also called as paraphilia, and sexual dysfunction. So these are main four types of sexual disorder, and we can learn different conditions under each classification. Now, gender identity disorder. In this, first we can study about transsexualism. Here in transsexualism, individual person feel some kind of discomfort regarding their own sex, and they're having a feeling to ride over the opposite sex. Okay, they wanted to be a person of opposite sex, where what's anatomical structure what they got, they're completely discomfort regarding to that. And gender identity disorder in early childhood. This what we can see in a small child. In early childhood, we can see that a child may be finding difficulty to identify their own gender. And dual role transsexualism. Dual role transvestism. In this dual role, what it mean is person want to ride the opposite sex for a temporary basis. For the temporary pleasure, they want to wear the clothes of opposite sex and they're enjoying that pleasure. And intersexuality, the word itself we can understand that here the person having a gross anatomical and physiological features of other sex. For example, Turner syndrome. Here person is experiencing that features of opposite sex will present in his body. So this what we can study under gender identity disorder. Transsexualism, gender identity disorder in early childhood, dual role transvestism, and intersexuality. The next category was psychological and behavioral disorder in sexual development. Here we can see a condition called homosexuality. Now, homosexuality means a person having a physical relation with the same sex. Usually what we can see is a heterosexuality where a male and female will have a physical relation, but here this is a condition where the person belongs to a same gender, they're involved in the physical activities. If the relation between girl and girl, this is called lesbians, and the relation between boy and boy, males, is called gay. Next is disorder of sexual preference. Now we can learn different conditions under disorder of sexual preference, it also known as paraphilia. Now first is fetishism. Now fetishism means here person getting a sexual arousal, like that's desire, a pleasure with the non-living objects like innerwears, panties, shoes, gloves, such things. When they use, they're getting a sexual pleasure. And transvestism, here sexual arousal occur by wearing the clothes of opposite sex. Person is feeling that arousal, a pleasure, a happiness when they wear the clothes of opposite sex. Sexual sadism. The word sexual sadism means person get the sexual desire, a pleasure by hurting or injuring his sexual partner. By hurting others, he is getting the happiness. Sexual masochism, it means like I'm the person, I am getting a sexual pleasure by hurting myself. I ask my partner to hurt myself so that I will get that sexual pleasure. That's called as sexual masochism. And exhibitionism. The word exhibitionism means a person is exhibiting his body parts, private organs to the other people, like without their consent. Like to the strangers, they are exhibiting their body parts and they are getting their happiness. And voyeurism, here a person get a sexual happiness, a pleasure by watching others, especially when they are naked or when they involved in the sexual activity. Okay, the next word is frotism. Here frotism means person is getting a sexual pleasure or desire by touching the body parts of others without their consent. Without their consent, they are touching the body parts of other, private parts of other, and they are getting the happiness. Pedophilia. The word pedophilia means a person getting a sexual desire or pleasure by involving himself in a sexual activity with the puberty children. Okay, very young age, puberty children, adult is getting involved in the sexual activity and getting the happiness. This is called pedophilia. Next is zoophilia. The word itself you'll understand. Zoophilia means person getting that sexual happiness when they involved with the sexual activities with the animals. Zoo, the word itself, zoo, we can understand is animal. Zoophilia. Also, we can see some other philias where the person get the sexual desire by with the help, like when they touch, get this arousal with the urine, feces, all those things. Okay, so these all conditions what we learn under paraphilias. Okay, paraphilias. Next is sexual dysfunction. Now, sexual dysfunction, what it is? Frigidity. Under this, what we are learning is frigidity. Frigidity means a complete absence of sexual desire, like a completely absence of sexual activity. That feeling, that involvement of activity, that will completely absent. And impotence. The word impotence means person is, it's a disorder, like what to say, there is a characteristics that where the penile erection till it will not wait till the completion of that a sexual activity, like a person is not able to maintain, person is not able to sustain that penile erection till the completion. He could not wait. Okay, then that will leads to the dissatisfaction of their sexual activity. This is called impotence. And premature ejaculation. The word premature, the word itself will understand, it is before we have a successful, satisfactory sexual relationship, person is having a penile ejaculation will occur. Now, when this ejaculation occur before the successful of their completely coitus, now then there will not be any kind of happiness. So this is called premature ejaculation. And non-organic vaginism. Now, non-organic vaginism means mainly it's involved the 1/3 of vaginal, that spasm. Okay, severe spasm can find in 1/3 of the vagina, where because of this pain they are not able to have a successful physical relationship. During a coitus they are really having a very bad pain. This is called non-organic vaginism. Okay, the next is non-organic dyspareunia. Now this what we can see in both male and female, they experience a very bad pain during their physical coitus. This is called non-organic dyspareunia. See, these all are the important sexual disorders what we can study. Mainly there are 4 types. I am summarizing again. The mainly 4 types: gender identity disorder, psychological and behavioral disorder associated with sexual development, paraphilias, and sexual dysfunction. Under gender identity disorder, we have studied about transsexualism, dual role transvestism, gender identity disorder in early childhood, and intersexuality. And physiological and behavioral disorder associated with sexual disorder, in that one condition what we are studying is homosexuality. And the next classification is paraphilias, like fetishism, transvestism, sexual sadism, sexual masochism, pedophilia, zoophilia, frotism, and voyeurism, and other paraphilias we can study. And the sexual dysfunction what we studied is impotence, frigidity, non-organic vaginism, and non-organic dyspareunia. I hope this sexual disorder chapter is like you easily understood, and definitely we can go for the diagnosis, like mainly we'll do the physical examination, mental state examination of the patient, and we can do some hormonal evaluation test can be done. And mainly what management we are doing is you need to assess the patient. provide some behavioral therapy like individual therapy to the patient. You can collect the detailed history of a patient, whether they had any sexual harassment or any like bad history where they're not able to cope with the things, and also provide some information regarding the healthy physical relationship. You need to provide some information so that they can improve their knowledge level. Also you need to plan certain behavioral therapy so that we can modify the behavior and understand their family, a cultural background, which will interfere their like sexual preferences, like that may lead to a sexual disorder. So let us understand all these things and provide a nursing intervention as per the patient need. So thank you. Please keep watching. We'll study some more new topics in some other videos. Thank you all.